Okay, this video is chapter 11 from the book Poor Man's Way to Prevent Dementia and Raise IQ. Here's the table of contents. I'll show you the table of contents right here. So we've gone through all these chapters before. I highlight them in yellow after I read them off. And today we're doing leaky gut, autoimmune disease, LPS for lipopolysaccharide, and then also we're going to include a little bit of discussion of amyloid clotting. That's a really interesting subject. It's good to know about it. Also just the concept of amyloid in general. And the things that LPS does, gram-negative endotoxin, LTA, lipoteichoic acid, gram-positive endotoxin, also will do many of the same things. Okay, so let's go to the chapter here. Oh, I got to go in the other way here. All right, so this is a drawing of leaky gut. First of all, on this side, we've got the normal gut. Then the arrow shows what happens with leaky gut. Leaky gut's the most common mechanism of autoimmune disease. And this is another example of what a joke medical textbooks are. If you go through a medical textbook, you won't even see any mention of leaky gut. It's the most important cause of autoimmune disease. And that's how it is for most chapters in conventional medicine. They don't talk about what actually causes disease, because if you don't know what causes disease, then you're stuck taking a pill or having a surgery. If you know what causes it, you avoid the thing that causes it, and you got a chance to get better. All right, so anyways, here's how the normal intestinal tract functions. The normal intestinal tract is also called the enteric tract. So the cells that line the intestinal tract are called enterocytes. Site means cell. Entero for intestinal tract. Okay, TJ stands for tight junctions. There's tight junctions between this. It's only a single layer thick, the intestinal lining. And the tight junctions prevent big particles of food or bacteria from getting deep to the enterocyte layer. There are cells called goblet cells that make lots of mucus. And the mucus keeps the bacteria from farther away from the enterocyte lining so they don't injure the enterocyte lining. In the more superficial level of mucus, or the inner mucus layer adjacent to the enterocyte lining, there's antimicrobial peptides, there's secretory IgA, antibodies, all this stuff, because you don't want those bacteria contacting the enterocyte level. Okay, and here in this one, in the outer mucus layer, I show smiley face for bacteria, and these bacteria are the good bacteria. Because humans have been around with bacteria for many thousands of years. I don't know the exact number of years, but basically they've sort of co-evolved with us, if you will, and they're symbiotic with us. That means we're mutually beneficial to each other. For a bacteria living in our intestinal tract, it's a good apartment. It's a good deal for them, and in exchange, they do some good things for us. Most important thing that we do for good gut bacteria is to eat fiber. And so the fiber, and by the way, Dennis Burkitt felt that humans should be eating at least 100 grams a day of fiber. Okay, the average American's probably only eating about 12 grams a day of fiber, which is next to nothing. Probably at a minimum, women should be eating around 40 or more, men around 50 or more, or really at least 25 or more. I eat over 100. Just if you eat a plant-based diet of whole foods, you're going to get up there pretty fast. Okay, so anyways, why is fiber so important? I think I showed you earlier about how it prevents abdominal pressure syndrome by bringing water to the stool, softening the stool, so when you defecate, it's like a cow patty, rather than if you have dried out stool, it's like a Tootsie Roll when you don't eat fiber. And then that leads to constipation, dried out stool, and the back pressure, abdominal pressure syndrome as described by Dennis Burkitt. Again, I think I had a nice picture of it and talked all about it earlier. Okay, but what's the other thing fiber does? Now we're going to talk about how fiber feeds the good gut bacteria. They take that fiber and they convert it into short-chain fatty acids. And so the short-chain fatty acids, there's a 2-carbon, and that's acetate. So the 2-carbon acetate, that goes into the portal vein, goes right up to the liver. Okay, then there's a 3-carbon propionate. Same thing, goes through the portal vein, right up to the liver. All right. Then they make a 4-carbon butyrate. And these, again, are very much like their simple organic chemistry names. Acetate like acetic acid like vinegar, 2-carbon. Propionate like propane, okay, 3-carbon. Butyrate like butane, 4-carbon. Okay, what I'm just saying is these names are logical. And then when you have ATE at the end of the name, that just means it's like an unprotonated fatty acid, okay? Unprotonated, deprotonated carboxylic acid fatty acid. Okay, so anyways, the important one to know about especially is butyrate. Well, actually, the relevance of the 2-carbon acetate, you can make even carbon fatty acids pretty easily. The 3-carbon propionate, throw one in there once in a while, you can make an odd number of carbons. Most of the time, they're even numbered. Okay, but getting back to butyrate, the 4-carbon short-chain fatty acid, that's the most important one. The enterocytes take the butyrate and they use that to make tight junctions. And then the tight junctions are essential for maintaining the integrity of the enterocyte lining. So you need to know that. By eating fiber, butyrate is produced, and the enterocytes use that to make their tight junctions, and that prevents leaky gut. That's the most important thing to know to prevent leaky gut, is to eat dietary fiber. Okay. So let's say somebody had an autoimmune disease. What would be the smart thing to do? The smart thing to do would be to eat a lot more fiber by eating whole plant foods and then avoid all the things that cause leaky gut. Okay, so then the next question is, well, what causes leaky gut? And there's a whole list of them right here. First of all, actually, let me show you what leaky gut means, and then we'll go through the list of things you can avoid to help reduce the risk of leaky gut. Leaky gut means there's a defect in the tight junctions, for example. This will allow bacterial endotoxins like LPS, lipopolysaccharide, or LTA. So lipopolysaccharide comes from gram-negative bacteria. LTA comes from gram-positive bacteria. And the LPS gets across the intestinal lining, and then it can incite an inflammatory response. It binds something called toll-like receptor number 4. It also can get into the blood, and it's very prothrombotic. It actually causes a distortion of the shape of the fibrinogen clotting proteins. We'll talk about that in a moment, but it's bad. Okay, sometimes entire bacteria can get across these gaps in the tight junctions, and the bacteria can even get into the blood. As long as the body keeps iron sequestered, they can't multiply in the blood, but they'll often remain dormant for a long time, and then if the person subsequently becomes iron overloaded, they can use that iron to be able to replicate. So that's why we sequester iron throughout our body, so that it's not sitting around where these bacteria can grab it. Okay, if they do become reactivated in the blood, they will then release some lipopolysaccharide, and that LPS, subsequently released into the blood, can cause a lot of abnormal blood clotting. Okay, additional things to be aware of. Normally when we eat protein, we will only dissolve, a single amino acid at a time, or 2 amino acids at a time, like a peptide, dipeptide, meaning 2, or a tripeptide, 3 amino acids together. That's normal. However, when there's a gap in the tight junction, sometimes big chunks of protein can get across that gap in the tight junctions, and then they now get into the tissue below the enterocyte layer. So the layer of tissue in the intestinal wall deep to the enterocytes is called the lamina propria. And when the chunk of protein coming from an animal gets into that location, our immune system recognizes it as foreign, and it will make antibodies to it. So those are antibodies to remove the pathogen. Okay, you'll sometimes hear the word PAMPs, and that means pathogen-associated molecular pattern. So when our immune system finds a molecule that is not part of self, and it knows the difference between self and non-self, it will make antibodies to it, and then that will incite a bigger inflammatory reaction to remove that molecule, whatever it is. Okay, you can also sometimes call these, if it's coming from bacteria, you can sometimes call them MAMPs, microbial associated molecular patterns. If you have damaged tissue, you can call them DAMPs, damage associated molecular patterns. Anyways, these are the things that activate the immune system to be recognized as foreign and incite an inflammatory response for removal of the foreign infection, foreign protein, or damaged structure. So anyways, the protein chunks come in, they're recognized by the immune system as foreign, antibodies are made, and now here's where the problem comes in. The sequence of amino acids in the protein, because they're coming from an animal rather than a plant, can be rather similar to the sequence of amino acids in proteins inside our own bodies. So while the immune system is able to recognize them as different enough to be labeled foreign and to be removed, the antibodies formed to them sometimes will be similar enough that they can bind to similar structural proteins in the human body and cause an inflammatory reaction against those. And that's what autoimmune disease is. It's when your own immune system is attacking your own body. So the fact that the animal protein's amino acid sequence mimics our own human protein amino acid sequences in our proteins. That's called molecular mimicry. And then the fact that the antibodies will sometimes then cross-react with our own tissue, that's called cross-reactivity. So the whole way you would describe it is molecular mimicry with autoantibody cross-reactivity. And that's just a fancy way of saying, leaky gut associated protein chunks mimicking our own bodily protein amino acid sequences causing this type of an immune reaction. So these are major reasons why you do not want leaky gut. It's a bad thing. And it can manifest in a lot of different ways. It can cause localized inflammation of the gut with things like irritable bowel syndrome, like Crohn's disease, like ulcerative colitis. That's all inflammation of the bowel wall. And then, of course, it can extend into other parts of the body, things like lupus, SLE, systemic lupus erythematous. It can also cause rheumatoid arthritis. In the brain, it can cause multiple sclerosis. And it can cause plenty of other autoimmune diseases like scleroderma. It can cause Sjogren's syndrome, for example. Okay, so if you've got leaky gut, what are you going to do? You want to avoid these things. Antibiotics can cause leaky gut because they will sort of remove the normal good bacteria. Glyphosate, the herbicide, was originally used as an antibiotic, and that will also potentially injure your normal good gut bacteria and contribute to causing leaky gut. Other herbicides, especially in non-organic food, more prone to doing that. Oils, the cooking oils, omega-6 oils have a tendency to do that. Then when you eat a high meat and processed food, there's very little fiber in processed food. There's zero fiber in meat. You'll have a tendency to not get enough fiber to your good gut bacteria, and then the bad gut bacteria start to proliferate, and they do bad things. They start to eat the mucus layer. You don't want that. Emulsifiers, these are things in processed food that are, like we talked about earlier in this chapter on fatty acids. They're amphiphilic, meaning they're part fat, part hydrophobic, but they're also part polar, aqueous, and they sort of hold processed food together, the aqueous and the fatty parts. Anyways, those can cause leaky gut. Persons who are fat, persons with diabetes have increased risk of leaky gut. These other chemicals in processed food, polysorbate, carrageenan, they increase the risk of leaky gut. BT corn itself intrinsically can be toxic to our gut lining. High fructose corn syrup is associated with increased risk of leaky gut. A lot of medications are associated with causing leaky gut. Non-steroidal inflammatory drugs like NSAIDs, non-steroidal anti-inflammatory drugs, ASA, acetylsalicylic acid, aspirin, antacids, proton pump inhibitors. Soaps, it's kind of similar concept as the emulsifiers. Dishwasher soap, that's why I always rinse my dishes and silverware off after it's come out of the dishwasher. If you don't cook with oil, you don't even really need a dishwasher. BPA is associated with increased risk of leaky gut. Women in general have a lot more autoimmune disease than men do. They get almost 80% of autoimmune diseases. And part of it has something to do with their estrogenic hormones. That's thought to be the case. Part of it is they change how the immune system functions. And part of that has to do with pregnancy. A woman being pregnant, having a baby in her uterus, that's almost like having a transplant. And so the body has to nourish the baby rather than, form an inflammatory reaction to it. But anyways, just in general, women have a lot more autoimmune diseases than men do. Okay, what are other things to consider here? The gluten protein, gliadin protein, similar to that. A woman on oral contraceptive pills with a yeast infection, increased risk of leaky gut. Artificial sweeteners increase the risk. Carbonated beverages like soda pop and beer. The phosphoric acid in the soda pop contributes to it. Heavy metals like aluminum, mercury, radiation therapy to the abdomen, chemotherapy. Traumatic brain injury. And when you ever have something that opens up the blood-brain barrier, like traumatic brain injury or stroke, it tends to open up the intestinal barrier. That's also why I think post-TBI, traumatic brain injury, or post-stroke, a lot should be done to try to prevent leaky gut. They should be given more dietary fiber. They should avoid these things that cause leaky gut because that can lead to secondary, increasing the amount of brain damage that occurs. Corticosteroids contribute to causing leaky gut. Titanium dioxide, having leaky gums, problems, dental problems, will increase the risk of bacteria getting into your blood through your mouth. So the good news is if you've got an autoimmune disease or you have other problems that might be related to leaky gut, here's an obvious list of things you can do. These are all changeable. to help yourself. And you really don't want leaky gut at all, because it also makes your blood more prone to clotting. They call it postprandial endotoxemia, meaning getting the bacterial endotoxins into your blood after eating, which especially happens after meals of processed food and a lot of saturated fat, for example. And those oils, I mean, it's not a good thing. Okay. So you got to make sure to eat that fiber. Okay, here's a little interesting stuff. You can get a tendency to form amyloidogenic clots. So actually, I think I got a picture. I'll show you a picture here in just a moment. Okay, I talked about the autoantibodies in the leaky gut. Talked about the glyphosate sprayed on the soy having antibiotic properties. It does a lot of things you don't want. It also contributes to fatty liver, according to Stephanie Seneff. It has a negative effect on sperm, and it's really bad for your health, and it has a excitotoxic effect on the brain. Okay, here's a picture I wanted to show you. And this is a pretty important concept to get. You want to get this concept. The idea is that a protein, a lot of proteins initially have a alpha helix structure. It's called secondary protein structure. And you can think of it as looking like a slinky. And so a lot of proteins are shaped that way. That's a good shape for proteins. But when they encounter certain situations, they will sometimes become transformed from being cylindrical alpha helix to becoming flat, like pieces of paper or a deck of playing cards. And this is called the beta pleated sheet configuration. You can see the hydrogen bonds in the alpha helix. They're within the molecule, so they're intra, I-N-T-R-A, intramolecular. All right, but once they switch to being flat and they form a beta pleated sheet, they can aggregate and stick to a whole bunch of other same type of proteins. So now the hydrogen bonds are between separate molecules. So these are inter, so I-N-T-E-R. Okay, and this becomes relevant because a whole bunch of them can all accumulate together and stack up. The bigger a molecule gets, the more likely it is to precipitate out of solution. Once a protein is precipitated out of solution, it's not functional. And these can also get big enough that they can have mass effect on other things. In the brain, beta pleated sheet precipitation of beta amyloid proteins is thought to lead to mechanical side effects like opening up of NMDA receptors, which can lead to excitotoxicity as more calcium enters the cytoplasm of a neuron. Okay, and this also is an example of how a protein can propagate itself. If you have a protein that changes from alpha helix to a beta pleated sheet, stacking up, precipitating out of solution, forming a relatively large mass given its context, that can push on other beta amyloid proteins and cause them to precipitate. And this is a way that a non-living thing, a protein, can propagate itself, okay? A little bit like, a domino effect, if you will. But trust me, that's going to come up a lot more in neuropathology, so you want to get that concept. Alpha helix being transformed by something into beta-pleated sheets with subsequent enlargement of the beta-pleated sheets aggregates, precipitating, and then having mass effect on other structures or propagating themselves. So G negative is for gram-negative bacteria making LPS lipopolysaccharide. G plus is for gram-positive bacteria making LTA lipoteichoic acid. Okay, so the big problem they cause in the blood is they really predispose to clotting. And the clots are with distorted fibrinogen, the clotting protein. It goes from its normal alpha helix configuration, which makes relatively nice blood clots. They look like pieces of spaghetti. Okay, it's a regular blood clot, the contribution of the fibrinogen. Whereas when you've got them transformed by the bacterial endotoxin into beta-pleated sheet configuration, they make more of what is called dense matted deposits, more thick irregular blood clots. And the relevance of it is that these thicker irregular blood clots are much harder to dissolve because there's always a little bit of dynamic equilibrium in our blood where little tiny clots are forming and then they're dissolved. Tiny clots forming and dissolved. But they're not so easy to dissolve when they're amyloidogenic type clots. Amyloid just means that you've made this transition from alpha helix to beta pleated sheets with the increased tendency to precipitate. These clots are a lot more difficult to dissolve, meaning that they're more likely to plug up arteries in your heart or your brain. And post-infection, people can have a viral infection and they can have a bacterial infection, and it can lead to formation of these types of clots. And in particular, I can tell you the long version of a recent well-known viral infection is thought in part is some of its side effects to be due to the formation of these types of clots, amyloidogenic clotting. And the two most famous people to sort of figure this out and give a lot of lectures on it are Douglas Kell. He's a PhD from England. The guy's a genius, okay? Well, he's a genius of research in his area, and so is Etheresia Pretorius. She's a PhD from South Africa. I've been very impressed by their research, their work, and some of their original discoveries. On the other hand, though, Douglas Kell, I joke a little bit, though, he's fat. And so what I'm saying is a lot of these PhD scientists, they're brilliant in their own given area, but they don't have wide knowledge of a lot of other things. So what I'm saying is anybody who really studies nutrition, they'll become a low-fat, low-sodium vegan and be skinny, okay? So, but anyways, Douglas Kell is brilliant. Him and Etheresia deserve a Nobel Prize. They'll probably never get it because, you know, anybody who does anything that starts helping the proles wise up never wins any awards. All right, but I do recommend if you check out Douglas Kell's videos like Systems Approach, and when he wrote a magnificent paper called Iron Behaving Badly. He's got some of the most cited papers ever in some of the journals that he's published in that him and Etheresia have. So anyways, just to be aware of it, that's a useful thing to know. And by the way, I started talking to the infectious disease doctors, a lot of the ones I know from universities, and most of them, they don't know anything about dormant bacteria. They don't know anything about amyloidogenic clotting. So don't think your conventional doctors are very well educated. Most of them are not. They know what they were taught in med school, which is the equivalent of being trained to be an internal medicine doctor, and that's really being trained to sell drugs. It's like every chapter in a conventional medicine book is pretty much the same. They all say the disease is idiopathic, you know, the doctor's an idiot, the patient's pathetic, and that it's partly genetic and partly due to aging. And so since nobody really understands it, you might as well take this pill and hopefully try to slow it down. And you think I'm kidding? I'm not. That's what almost every chapter is like in the medical book. And the other thing, too, is you're only going to hear germ theory. You're never going to hear terrain theory. And you should know both. With regard to infectious diseases, it is relevant and a good idea to be familiar with both germ theory and terrain theory. Okay, germ theory is classically the work of Louis Pasteur, and terrain theory is classically the work of Beauchamp. Okay, we also talked about you don't want to be iron overloaded because the iron is needed by the bacteria to proliferate in your blood. If you keep your iron levels low, and like I said, it's good to keep your serum ferritin level down, you know, in the ballpark of, let's say, 25 to 80. Okay, drinking alcohol can injure liver cells and free up some iron. You don't want that. Okay, now I've got to show you a bunch of papers. Just for those of you who are curious, like I said, the first step would be go on the internet and watch videos about Douglas Kell and Etheresia Pretorius, okay? Because you'll be amazed at how smart these two are. And here's just a typical paper. Acute induction of amyloidogenic blood clotting by bacterial lipopolysaccharide. So that's what we just talked about. So induction means causing amyloidogenic type clots, the dense matted deposits that are very difficult to dissolve, unlike the good old-fashioned piece of spaghetti linear type clots, and due to their bacterial lipopolysaccharide, which we usually just call LPS. Okay, so here's one of the papers. And I'm letting you know about Doug Kell and Etheresia Pretorius because I think that really helps a person's education to know them. They're really smart, innovative scientists. They're really good. Okay, and this just talks about activation of toll-like receptors. And, you know, remember, it's a high-fat, low-fiber diet that causes these problems. It also is associated with increased risk of being depressed, you know, MDD, major depression disorder, okay? And sick behavior is a little bit like being depressed, although depression is obviously more complex than that. But food does have a big effect on mood. And if somebody's depressed or has another one of these, you know, related psychiatric conditions, like anxiety, for example, attention deficit, it's a good idea to try to fix all this nutritional stuff because you might be able to cure the patient at no cost, at no side effect, and you avoid all the side effects of those drugs. Okay, here's another paper on the translocation of bacteria and LPS between the blood and peripheral locations. Okay, and it's going to be dormant bacteria, how they can be reactivated by iron in the blood. I'm basically just showing you a lot of the papers of Douglas Kell and Etheresia Pretorius because it's real important to get this, okay? And if you have the long version of the recent viral infection, a lot of times what they think is the mechanism for all that is these amyloidogenic clots, and they can be a big deal. They can plug up arteries in cardiac muscle, the myocardium, and they're difficult to dissolve. What would I do if I had that problem? Well, I'm already a low-fat, low-sodium vegan and no oil or anything else that's prothrombotic, and that gives you the best chance that your body's fibrinolytic system, clot dissolving system, can catch up and dissolve those clots before they cause irreversible strokes in your brain or irreversible small myocardial infarctions in your heart. Okay, trust me, it's important to know. That's why I'm going over all this. I'm trying to help you. Because, that's kind of the whole point of this book, is to empower the reader with ways to improve their own health. And I think the reason why conventional doctors are not taught this stuff is because if a patient gets educated in all this stuff, they can really solve most of their own problems. There's some things, of course, you need to go to the emergency room, but most of the common stuff, it's solvable if you know what you're doing. I don't ever go to a doctor. I am a doctor. I know how to prevent these problems. Okay, dormant bacteria reactivation, iron in the blood, I told you all about that. Bacterial requirement for free iron explains the strong coexistence of these diseases and iron dysregulation, LPS production, and inflammation. Yeah, you can get the iron to start the redox cycle between Fe2 plus and Fe3 plus, like I just went over in a recent chapter. I think that was chapter 9 or something. And that creates a method of amplification of the disease. Whenever you have a lot of these bad diseases, there's going to be some form of vicious cycle whereby they continue to amplify themselves. And ferrous redox cycling is a big mechanism for amplifying a problem. And so is, like I just referred to, this amyloidogenic clotting, transforming proteins from their normal alpha helix shapes, configurations, to beta-pleated sheets where they become large, precipitate out of solution, and start to push on other things and potentially propagate themselves. That's a big deal. Okay, another paper by Douglas Kell and Etheresia praetorius, the dormant blood microbiome. So this is another key point. There's a lot of bacteria that can sit around dormant in our blood. And when you first say this to people, like I first said this to some university infectious disease doctors I know, they give you this sort of arrogant look, like, are you stupid? Are you weird? Why are you talking about this? You don't know what you're talking about this. I'm obviously a fellowship-trained expert in this subject. Okay, and then, you say, well, let's talk a little common sense here. We know that there's tertiary syphilis, and that can cause, dementia. That's what caused dementia in Al Capone. That's what caused dementia probably in Nietzsche. That's what caused dementia in, Winston Churchill's father. That's what caused dementia in a lot of famous people and famous writers, like some of those French writers were fooling around with prostitutes. They shouldn't have been doing that, and they got tertiary syphilis, became demented from that. Okay, so anyways, we know that was syphilis. We know that tuberculosis is a bacteria, and that'll have a dormant phase, and you can get reactivated tuberculosis. Everybody knows that. Everybody knows you got Lyme disease. You can get reactivation of Lyme disease, okay, and that can cause dementia. Chris Christopherson had Lyme disease. They originally thought it was just Alzheimer's. When they treated the Lyme disease successfully, he got better. Okay, so then we know there's a whole bunch of less famous bacteria that can have these dormant phases. We know bacteria once in a while can show up in atherogenic plaques. I think they're actually just scavengers trying to eat the blood within the atherosclerotic plaque, which is really a blood clot. Anyways, but the reason I went through that is it's well known that there's tons of different types of dormant bacteria, and that the smart move is avoid leaky gut, avoid leaky gum, so you minimize this problem. All right, and avoid things that cause excessive free iron, so you avoid all these problems. And it's well worth knowing. And infectious disease doctors really ought to know this. But if they only read their textbooks, most doctors have only read the textbooks in their field, and then they have to study for their boards exams, which are based on those textbooks. And most of them don't really read much outside of that, for the simple reason that by the time they finish their residency and fellowship, they're exhausted, and most of them have delayed having children, so they decide to have their kids. Sometimes they also are struggling to make partner at their job, and they get overworked. They get all the lousy rotations, lots of night calls, night shifts, so they're exhausted. Then they want to try to get married and have the kid, sooner rather than later before the woman's infertile. And now they're even double exhausted, taking care of the kid, trying to make partner, trying to get established in their new job. And then the place that hires them typically tries to work the crap out of them, make as much profit off of them as it can, and pressures them, go faster, go faster, go faster, make more money for the hospital or the clinic, or you're going to lose your job. That's what life is like for a doctor. So they work their tails off. There's no incentive whatsoever to do anything outside of standard of care, because as long as you practice standard of care, you can't be sued. You're guaranteed to get paid. It really doesn't matter what happens to the patient. Nobody keeps track of what happens to patients anyways. And that's the life of a typical doctor. So, I'm a fluke in the sense that I sit around reading all the time because I got nothing else to do. Okay, most doctors are tired and exhausted, and they don't got time to read. They're just trying to take care of their kids and keep it together. Okay, so anyways, I just put a couple of these papers in here because I wanted to show you what a big deal all this stuff was. And it's not just Kellen Pretorius. Other people have repeated their findings in their work. Here's just another thing. Elementary lipemia enhances procoagulatory effects of inflammation. So this is relevant too because a lot of patients are hospitalized because they've had a thrombotic event. By the way, hardly anyone ever dies from bleeding. Yeah, you see it on a TV show. We've all heard of people dying from bleeding, but it's a rare event. What people mostly die from is blood clots. A stroke is due to a blood clot. A heart attack is due to a blood clot, okay? So things that make blood clots are more likely to cause the patient to die. So you don't want this fat in your blood. You don't want bacteria in your blood because they increase the likelihood of clotting. You don't want high dietary sodium potentially activating platelets, increasing your risk of clotting. So you get this combination of leaky gut with bacteria in your blood, bacterial endotoxin in your blood, and this fat sticking your red blood cells together in the context of high sodium diet. So now you're vasoconstricted, meaning your arteries are narrowed. They're more vulnerable to becoming occluded by a clot. This is all bad. Okay, so I'm just showing you more papers. They all show the same thing. And I gave previous lectures where I talked about how a high-fat meal will cause activation of your neutrophils, release of myeloperoxidase, and that will cause a collapse of your endothelial glycocalyx, and that's pro-clotting. So anyways, that's it for this chapter on autoimmune disease. Actually, a few other things I would say about autoimmune disease. What else can cause autoimmune disease? I went through all those things that cause leaky gut, poor dentition, too many sweets, not brushing your teeth, acidic foods, not taking care of your teeth. It's good to, after you eat a meal, rinse your mouth off with some water, for example, and then clean your teeth with like interdental brushes or to floss, especially at night before you go to bed, because at night you'll have decreased saliva production, and so you're more vulnerable to forming cavities. Also, be careful if you're taking a medicine, like an anticholinergic medicine or something, that'll further decrease your saliva, greatly increase your risk of getting dental cavities and gum disease as well. And that'll predispose you to leaky gums and, the stuff in your blood. Other things that can cause autoimmune disease would include chemicals like glyphosate, the herbicide, the Roundup that's sprayed on GMO soy. Its name is glycine phosphate, and the relevance is that it's, according to Stephanie Seneff, who's done over like a decade of research on it, it can substitute for glycine in proteins, for example, in collagen, and distort their shape, and that's thought to potentially lead to autoimmune disease. F-, like what is in the water, most of the tap water in most cities, that can switch out for hydrogens in some proteins and distort their shape and potentially lead to autoimmune disease. There's other things that can cause autoimmune disease, like, for example, if you just have high levels of estrogenic chemical in your blood because you eat a meat-based diet, because you use lots of personal care products, that can increase your risk of an autoimmune disease. Just from eating meats, like red meat, you can get a condition called xenocylitis, where you have these like new 5-GC sialic acids that are accepted into your body, but then later on recognized by the immune system as foreign, and that inciting an inflammatory response. And just meat in general, you can get more of something called TMAO, causing these areas of nonspecific inflammation in your body. So anyways, some of the first things you could do to reduce bodily inflammation is avoid all animal foods and avoid all these cooking oils, because the cooking oils themselves can cause all kinds of nonspecific inflammation. So usually when we talk about autoimmune disease, we're talking about autoantibodies. It's also been mentioned, Dr. McDougall had a good lecture on this, that when a person eats a hot dog, they just grind up the animal and stick it into the container for the hot dog. You can grind up the animal's thyroid, and then you can form autoantibodies to their thyroid tissue. That can lead to molecular mimicry and autoimmune disease. So once you understand these things, you're empowered to avoid all these things that can cause autoimmune disease. And it's worthwhile to give these things a try before you then get subjected. If you go to a rheumatologist who's going to treat your autoimmune disease, they can put you on very powerful drugs. And so it's a wise move to try to solve these problems first by your own diet and behavior, if that is doable. In addition, some people even think some of the heavy metals can cause autoimmune disease. In particular, there's several papers claiming that they think that aluminum can be neurotoxic and even cause increased risk of multiple sclerosis because they find increased aluminum in the brains of the patients with MS. There's also papers suggesting that MS is especially due to dairy proteins. There's like a butyrophilin dairy protein that's been associated with causing multiple sclerosis. It's thought that type 1 diabetes, like in young children, is due especially to dairy proteins with molecular mimicry, autoantibody cross-reactivity. Okay, well, multiple sclerosis is a cause of dementia. Clotting and clotting of brain arteries is a cause of dementia. Things that cause leaky gut often end up causing leaky blood-brain barrier, and vice versa. Things that cause leaky blood-brain barrier, like stroke and traumatic brain injury, often cause leaky gut. And that's also what I talked about. Somebody has a stroke or a traumatic brain injury, you want to simultaneously jump on that opportunity to protect their adjacent brain tissue. When you have a brain injury, the tissue that's destroyed where the cells are all dead, that's called the core of an infarct, for example. But there's a lot of adjacent tissue to the site of traumatic brain injury or stroke that's called a penumbra. Penumbra means, like in Greek or Latin, twilight. And so that, in a sense, is tissue that could live or die. And the way you keep that tissue alive, is best chance of doing it is low fat, low sodium, vegan diet, minimize stress, let them take some time to relax and recover. Avoid caffeine, all this other stuff. Avoid all these brain toxins like I'll talk about in subsequent chapters. All right, rather than, I think most neurologists in my experience, and certainly most ICU doctors, in fact, I've never met a single one that's been aware of this sort of thing. And it's just an additional opportunity to protect the brain. Avoid the things that cause leaky gut, because any toxin that gets across that leaky gut while they subsequently have an especially open blood-brain barrier can get into the brain parenchyma and damage brain tissue and wipe out that penumbra of tissue that could go either way at that point. Okay, so anyways, this was a chapter on autoimmune disease, in particular as it relates to brain damage. And I especially wanted you to learn about the amyloidogenic clotting, because I think that's an essential mechanism to understand to protect the brain. Okay, I hope that was useful.